The ER was chaos, code after code, and nobody noticed the janitor in the corner. "Out of the way," Dr. Voss snapped, shoving past her mop bucket. She didn't respond. Never did. "Honestly, why do they even let maintenance linger during traumas?" a resident muttered. That's when the gurney burst through the doors. Gunshot wound, GSW to the chest, bleeding out fast. The patient's eyes flickered open, locked onto her face. Then he did something no one expected. He snapped to attention, on a stretcher, bleeding. "Commander," he gasped. The ER went silent. Dr. Voss froze. "What did you just—" "Commander Keller," the soldier repeated, his hand trembling into a salute. "3rd Battalion, you saved my life in Kandahar." Her mop clattered to the floor. They didn't know. They couldn't know. Keller lunged forward, her hand shooting out to grab the soldier's arm. "You're confused. You've lost blood." Her whisper was urgent, desperate. "Stop talking, please." The soldier's eyes wouldn't leave her face. "Commander Keller, 3rd Battalion, 75th Ranger Regiment." His voice was getting stronger, not weaker. "You pulled me out of that Humvee in Kandahar. You saved my life." Dr. Voss stepped between them, her face twisted with irritation. "He's delirious from blood loss. Security, get her out of here, now." But the soldier was trying to sit up, his hands clawing at the IV lines. "Ma'am, Commander." His fingers found the tubing, started pulling. "You have to help them, like you helped us." The monitors erupted into screaming alarms, blood pressure dropping, 80/40. A resident fumbled with the central line kit, hands shaking. "I can't get the landmarks. I can't find the vein." 70/35. The numbers fell like stones. Keller backed toward the door, her shoulders hitting the wall. Her hands were shaking so badly she had to clench them into fists. Not here, not now, not after 4 years of silence, 4 years of keeping her head down, her mouth shut, her past buried under bleach and mop water. She couldn't do this again, wouldn't do this again. The resident stuck the patient a 3rd time, a 4th. Blood welling up from failed attempts. Someone page cardiothoracic. Dr. Voss's voice was rising, cracking at the edges. "Get me an attending. Get me anyone who knows what they're doing. 60/30. The soldier's hand slipped off the edge of the gurney, fell limp. Keller saw the tattoo on his forearm as his arm swung free. 3rd Battalion insignia, Ranger scroll, the same ink she'd seen on 100 other soldiers, 1,000 other soldiers. Then the monitor flatlined, one long, endless tone. No. Dr. Voss grabbed the crash cart, starting compressions. Someone page cardiothoracic. "Move! Move!" The wall clock read 2:47 a.m. Keller's vision tunneled. 4 years. 4 years of invisibility. 4 years of silence. 4 years of pretending she was nobody, nothing, just a woman who cleaned up other people's messes because she couldn't fix her own. The resident was doing compressions. Wrong rhythm, wrong depth, wrong hand placement. The soldier's chest was caving under his palms. A flashback hit her like shrapnel, desert sand in her teeth, explosions shaking the ground, her voice cutting through the chaos, steady and sure. "Clamp that artery, move, he's got 30 seconds. Her hands slick with blood that wasn't hers. She blinked. The ER came back into focus, the soldier's hand, still hanging, still tattooed, still dying. No. The word came out before she could stop it. Her feet moved, fast. Keller shoved past the resident, her hands already reaching. "Stop! You're compressing wrong. You'll rupture his liver." Dr. Voss whipped around. "Excuse me? Security." But Keller's hands were already on the patient, fingers probing his left side. Intercostal hemorrhage, left side. She could feel it, the tension, the fluid, the blood pooling where it shouldn't be. "He needs a finger thoracostomy. Now." Dr. Voss actually laughed. The sound was sharp, disbelieving. "A janitor's giving orders in my ER?" Keller didn't look up, didn't look at Voss, didn't look at the resident staring at her like she'd lost her mind. Her eyes stayed on the patient, on his chest barely moving, on the monitor still screaming its flat, dead tone. "I'm not asking." Her voice changed, dropped an octave, became something else entirely. Scalpel, betadine, chest tube kit. This was the voice that had commanded 200 soldiers, the voice that had barked orders over gunfire and mortar rounds, the voice she'd buried 4 years ago and sworn she'd never use again. A nurse stepped forward. Older. Gray hair pulled back tight, eyes sharp with recognition. She'd seen something, knew something. She handed Keller a pair of gloves. Keller snapped them on. Her hands stopped shaking. Muscle memory took over. 4 years of suppression, 4 years of hiding, 4 years of forcing herself to forget. None of it mattered now. Her fingers knew what to do, had done this 100 times, 200 times, in tents and trenches and the backs of helicopters with rotors screaming overhead. Scalpel. Someone put it in her hand. Incision. Clean. Deep. The blade went exactly where it needed to go, between the ribs. 5th intercostal space. Perfect angle. Perfect depth. Rib space located. Her finger went in next. The training came back like she'd never left the field. Finger sweep, clear the space, feel for obstructions. Blood poured out, not a trickle, a flood. 800 cc's of hemothorax, dark venous blood that had been crushing his lung, drowning him from the inside. The monitor beeped, changed pitch, found a rhythm, blood pressure climbing, 90/50. The resident inserted the chest tube where Keller had made space. His hands were steadier now, following her lead, 100/60. The soldier gasped, a real breath, deep, ragged, alive. His eyes fluttered open. The ER went silent. No one moved. No one spoke. Even the monitors seemed quieter, their beep steady and sure instead of screaming. Dr. Voss stood 3 feet away, her face the color of old paper. Her mouth opened, closed. No words came out. Keller pulled off the gloves, dropped them in the hazard bin. Her hands were steady now, perfectly steady. The tremor that had lived in her fingers for 4 years was gone, burned away by adrenaline and old instincts that refused to die. She looked at the soldier, at his chest, rising and falling, at the monitor showing vitals that meant life instead of death. Then she looked at her hands. These hands had held scalpels in sandstorms, had clamped arteries while bullets pinged off metal walls, had saved lives and lost lives, and carried the weight of every choice she'd ever made. She'd tried to make them forget, tried to teach them to only grip a mop, to only push a bucket, to only clean up messes that didn't bleed. But they remembered. They remembered everything. The older nurse was staring at her with something like awe, something like recognition. One soldier always knows another, her eyes seemed to say. A resident whispered to another, "Did you see that?" Dr. Voss finally found her voice. "Who are you?" Keller didn't answer. She turned toward the door, her legs suddenly weak. She needed to leave. Needed to get out before anyone asked more questions, before anyone dug deeper, before the past she'd spent 4 years burying clawed its way to the surface. But the soldier's voice stopped her. "Thank you, Commander." She closed her eyes. That word, that rank, that life. It was supposed to be dead, supposed to be over, supposed to be something she'd left behind in the desert sand and the review boards and the congressional hearings that had picked apart every decision she'd ever made. But here it was. Alive. Breathing. Looking at her with gratitude instead of accusation. Keller's hand found the door handle. Then the ambulance bay doors burst open again. Incoming. The EMT's voice cut through the silence. Multi-vehicle accident, 3 critical, 2 minutes out. Dr. Voss turned to the staff. Everyone to stations. Prepare for mass trauma. Her eyes found Keller, locked on, held. "You, stay." It wasn't a request. Keller's hand fell from the door. The past she'd been running from had finally caught up, and the ER was about to see exactly who she used to be. The soldier was stable, unconscious but breathing. The monitors beeped their steady rhythm. Normal sinus, adequate pressure, oxygen saturation climbing back to acceptable ranges. Keller moved toward the door. Dr. Voss stepped into her path. "Who the hell are you?" Keller's eyes dropped to the floor, to the tile she'd mopped 1,000 times. She said nothing. Her jaw clenched so tight her teeth ached. The older nurse moved closer, her voice quiet but firm. "Those hands. I've seen field surgeons work, combat medics. That wasn't luck. That was training. Years of it." Keller still wouldn't look up. Voss opened her mouth to say something else, but the ambulance bay. Doors crashed open. The EMTs were already shouting. Multi-vehicle accident, 3 critical. Teenager with steering column impalement, middle-aged male with crush injuries, elderly woman with head trauma. The gurneys rolled past in a blur of blood and chaos. Dr. Voss turned to Keller, her eyes sharp. "You're not going anywhere. If you can actually do what you just did, I need you here, right now." Keller shook her head. The motion was small, desperate. I can't. I don't. Not anymore. But Voss was already moving toward the trauma bays, her voice rising over the noise. Get me imaging on the impalement. I need to visualize before I go in blind. Keller pressed herself against the wall, tried to disappear into it. Her hands found the mop handle she'd left propped in the corner. The wood was smooth under her palms. Familiar, safe, not a scalpel, not a clamp, not a decision that meant life or death, just a mop. The teenager was screaming, high and thin and terrified. The steering column had gone through his abdomen, and the imaging showed a mess of torn tissue and blood. Dr. Voss stood over him, hands hovering, trying to work out the angle. I can't see it. Her voice was tight with frustration. There's too much damage. I can't find the bleeder. The vitals monitor showed falling pressure. The numbers dropped steadily, relentlessly. 1 minute passed, 2, 3. Voss tried clamping, tried packing, tried everything she could think of. The teenager's mother was screaming in the hallway. Someone let me see him. Please, please let me see my son. 4 minutes. The boy's pressure kept falling. Keller stood in the corner. Her knuckles were white on the mop handle, 19 years old. Same age as Daniel's had been, same terrified eyes, same desperate need to live. A flashback hit her. Desert heat. A different teenager on a different table, blood soaking through field dressings faster than she could replace them. I'm trying, she'd said. I'm trying. But there had been too much damage, too many injuries, too little time. She'd made the choice, triaged him as expectant, moved to someone she could save. He'd died calling her name. The monitor alarm pulled her back. The teenager's pressure was critical now, 60/30, then 50/20. His mother's screams got louder. Keller's hands released the mop. It clattered to the floor. She moved forward. It's the subclavian. Her voice cut through the chaos. You're going dorsal when you need to go ventral. The angle of entry pushed everything forward. You're looking in the wrong place. Dr. Voss spun around. What? Keller was already beside her, hands out. May I? Voss hesitated, then stepped aside. Keller's fingers moved with absolute certainty. Here, she guided the resident's hands. Feel that? That's the vessel wall. Follow it. Not there. You'll nick the artery. Here, gentle pressure, proximal control first. The resident clamped where she indicated. The bleeding slowed, stopped, now distal. Keller's voice was steady, calm, the teaching voice she'd used with 100 combat medics in 100 forward operating bases. Visualize the anatomy. Don't guess. No. The bleeder was found, controlled, repaired. The teenager's vitals started climbing. 70/40, 80/50. Color returning to his face. His eyes opened, confused, alive. Dr. Voss was staring at Keller like she was seeing her for the first time. Where did you train? Keller stripped off the gloves, dropped them in the bin. Her voice came out quiet, measured, each word carefully chosen. Fort Sam Houston, Advanced Trauma Life Support, Combat Casualty Care. Your military. Was. Voss's eyes narrowed. What rank? The pause stretched out, long, heavy. Keller could feel every eye in the ER on her, the residents, the nurses, the techs, all watching, all waiting. Commander. The word tasted like ash in her mouth. Army Medical Corps, 3rd Battalion, 75th Ranger Regiment. The ER went silent. Someone dropped an instrument. The clatter echoed. The resident who'd told her to get out of the way earlier turned bright red. His mouth opened and closed like a fish. Dr. Voss processed the information slowly. You were a combat surgeon with special forces, field trauma surgeon. Keller's voice was flat, emotionless. 13 deployments, Afghanistan, Iraq, Syria, 13. Voss repeated the number like she couldn't quite believe it. 13 deployments? Keller didn't respond. She turned back toward the door, back toward escape, back toward the invisibility she'd worked so hard to maintain. But Voss wasn't done. Her voice dropped, became quieter, almost gentle. Why are you mopping floors? Keller's face went blank, shuddered. That's not your concern. She took 2 steps toward the exit. The radio on the charge nurse's desk erupted with static. Dispatch to County General. Mass casualty event, factory explosion, 6 critical incoming. ETA 4 minutes. Repeat, 6 critical incoming. The ER erupted into controlled chaos, people moving, preparing, calling out assignments. The hospital administrator appeared in the doorway. A thin man in a suit that cost more than Keller made in 6 months. His face was pale. "We're overwhelmed. We need all hands. Where's Voss?" "Here." Dr. Voss stepped forward. "We're already running at capacity. We've got 3 criticals from the MVA. Now 6 more? We don't have the staff." The administrator's eyes swept the room, landed on Keller standing there in her janitor's uniform. "Who's this?" Dr. Voss hesitated. Then her jaw set. "Apparently, someone who can save lives we'd lose." The administrator looked from Voss to Keller and back again. "I don't care if she's a janitor or the Surgeon General. If she can help, she works. We'll sort credentials later." Keller felt the walls closing in. 4 years. 4 years of hiding. 4 years of anonymity. 4 years of pushing a mop and keeping her head down and pretending she was nobody special. All of it about to be ripped away. "I can't." Her voice came out strangled. "I'm not cleared. I'm not credentialed. I'm not even supposed to be here." The administrator's face was hard. 6 people are going to die in the next hour if we don't have enough hands. You want their deaths on your conscience? Fine. Walk out that door. But if you stay, you work. The ambulance sirens were getting louder, closer. 2 minutes out. Keller's hands clenched into fists. She could see it playing out. The chaos, the blood, the impossible choices, the triage decisions that would haunt her for years, just like before, just like Fallujah, just like the moment that had destroyed her career and her life and everything she'd believed about herself. Dr. Voss was watching her. The older nurse was watching her. The residents were watching her, all of them waiting to see what she would do. The teenager she'd just saved was being wheeled past to imaging. He caught her eye, mouthed 2 words. "Thank you." The sirens were right outside now. 1 minute. Keller closed her eyes, took 1 breath, 2. When she opened them, something had changed, some decision made, some line crossed that couldn't be uncrossed. She stripped off her janitor's uniform shirt. Underneath, she wore a plain black tank top. She rolled up her sleeves. "Where do you need me?" Dr. Voss's expression shifted. Relief, respect, maybe something else. "Trauma Bay 1. Take the lead. I'll back you up." The doors burst open. 6 gurneys, 6 broken bodies, 6 lives hanging by threads. Keller looked at them, at the blood, at the chaos, at the thing she'd sworn she'd never do again. Her voice came out steady, strong, the command voice she'd buried 4 years ago. "Listen up. We're going to triage, fast, efficient, by the book." She pointed at the residents. "You're on airway management. You're on hemorrhage control. You're on vitals monitoring. Move." They moved. Dr. Voss stood beside her, and for the first time, there was no mockery in her eyes, just a colleague, just another surgeon in the storm. The thing Keller had been hiding was fully exposed now. There was no going back. The gurneys came through the doors like a wave. 6 of them, all at once, wheels shrieking, EMTs shouting, blood trailing across the clean floor Keller had mopped just hours before. Chaos, pure chaos, a woman screaming, a man gurgling through a crushed airway, alarms from 6 monitors blending into one endless wail, the smell of burned flesh and diesel fuel and terror. The residents froze, eyes wide, hands hovering uselessly. Dr. Voss moved between patients, trying to assess, trying to prioritize. Her voice rose with each second. "I need help here. Someone get me vitals on this one. Where's respiratory? Where's anesthesia?" She was losing control. Keller stood motionless in the center of the storm. Her eyes moved, left to right, patient to patient, 10 years of combat medicine taking over, assessing, calculating, prioritizing, 1 breath, 2. Then she opened her mouth and let the command voice out. "Listen up." The entire ER stopped. Every head turned. Every conversation died. Even the monitors seemed to quiet. Keller moved, fast and certain, 10 seconds per patient, her hands checking pulses, airways, bleeding, her eyes taking in everything, processing, deciding. She pointed at the first gurney, expectant. "Tag him black, make him comfortable." The second, immediate. "Red tag, needs surgery now." Third, delayed, yellow tag, stable for transport. Fourth, immediate. Red tag, 5th, delayed, yellow tag, 6th, urgent, orange tag. Needs intervention but can wait 30 minutes. Her fingers stabbed toward residents. "You, airway management on immediate 1. U. Chest decompression on immediate 2. U. Massive transfusion protocol. Activate now. Dr. Voss opened her mouth. Wait. We need to discuss treatment plans before we just start cutting into people and making unilateral decisions about care without proper consultation and protocol adherence, because this is still my emergency room and I am still the attending physician on duty tonight, despite whatever rank you may have held in some other context entirely. Keller turned, looked her dead in the eye. You want to save lives or protect your ego? Choose. The words landed like a slap. Voss's face went red, then white, then she nodded. Once. Sharp. Keller turned to the nurses. I need O-negative blood. 4 units per immediate patient. Warming protocol. Someone call the OR. Tell them we're coming up with 3. Maybe 4 if we're lucky. They moved. Everyone moved. She wasn't asking, wasn't suggesting, wasn't requesting. She was commanding, and they obeyed. The ER transformed. The chaos organized itself. Residents found their assignments, nurses moved with purpose, equipment appeared where it was needed, IV lines, monitors, medications. Keller moved between the immediate patients, directing, correcting, teaching even in the middle of crisis. Not like that, like this. See the angle? Feel the resistance? That's the vessel wall. Don't push through, gentle. Dr. Voss worked beside her now, not challenging, not questioning, just following the lead of someone who'd done this 1,000 times in places where mistakes meant body bags. Then, Keller reached the worst case. Male, 40s, crushing chest trauma, both lungs collapsed, internal bleeding, pressure dropping fast, 70/30 and falling. The resident looked up, face pale. He won't make it upstairs. We'll lose him in the elevator. Keller's hands were already moving, palpating, assessing. Then, we work here. Dr. Voss stepped closer. Work here? You mean an emergency thoracotomy? In the ER? That's insane. We're not equipped for open chest surgery in a trauma bay without proper sterile fields and surgical teams and backup plans if something goes catastrophically wrong. Keller was already scrubbing, already gloving. Her voice was ice. I've done this in a tent with mortar rounds incoming. You have walls and lights. We're equipped. She picked up the scalpel. Incision. The blade went through skin, through muscle, between the ribs. Fast, precise, no hesitation. Rib spreaders. Someone handed them to her. She cranked them open. The chest cavity gaped. Blood everywhere. Pooling, pulsing. There. Keller's finger pointed. Intercostal artery torn. Clamp. She clamped it. The bleeding slowed. More blood welling up from deeper. The heart itself struggling. Barely beating, manual cardiac massage. Her hands wrapped around the organ, started squeezing, rhythmic, precise. 30 compressions. Pause, ventilate now. The respiratory tech bagged the patient, rhythm check. The monitor showed a flicker, then a beat, weak but there, another beat, another. Pressure climbing, 80/40, 90/50. Keller's hands kept working. Tying off bleeders, packing damage, doing the impossible with steady fingers and absolute certainty. The heart beat stronger, steadier, 100/60. She stepped back. Let the resident close. Her hands were covered in blood up to the elbows. The entire ER was watching, silent, stunned, speechless. 2 hours later, all 6 patients were stabilized. 3 in surgery, 2 in ICU, 1 in recovery. Even the expectant patient was still alive, comfortable, his family at his bedside. Keller peeled off her gloves. Her hands were shaking now, the adrenaline draining away, leaving nothing but exhaustion and memory. She sat heavily against the wall, slid down until she was on the floor, knees up, head back, eyes closed. Dr. Voss approached slowly, carefully, like approaching a wounded animal. That was something I've never seen in my entire career as an emergency physician, and I honestly do not even have words to adequately describe what just happened here tonight. Keller's eyes stayed closed. Fallujah, 2021. Vehicle convoy ambush. The words started coming. She couldn't stop them, didn't even try. 17 casualties, 3 hours, no resupply. I lost 4 of them. Her voice broke on the number, including my medic, 22 years old, Daniels. She bled out while I was trying to save a colonel who'd taken shrapnel to the femoral. I made the choice. Triage decision. He had a better chance. The math said, save him. She opened her eyes, stared at nothing. She died calling for me. I was 30 feet away, could hear her. Couldn't leave him or he'd bleed out too. So I stayed, finished the procedure, stabilized him, silence. By the time I got to her, she was gone. Dr. Voss said nothing, just listened. Army investigated, said I made the right call. Keller's laugh was bitter, broken. Right call, that's what they called it. Proper triage protocol, textbook decision-making, maximum lives saved. Her family didn't see it that way. Media didn't see it that way. Commander chooses rank over enlisted. That was the headline. Like I gave a damn about his rank. Like I wasn't trying to save everyone. Like I didn't know all their names, all their stories, all their families waiting back home. Death. Threats. Congressional inquiry. They cleared me, but the damage was done. I couldn't do it anymore. Couldn't make those choices. Couldn't hold a scalpel without seeing her face. So I came here. Took the first job where nobody would ask me to decide who lives and who dies, where I could just push a mop, keep my head down, try to forget. The ER was silent, then a voice from across the room. The first soldier, the Green Beret, awake now, sitting up in his observation bed, being wheeled out by a nurse. Commander Keller never forgot a single soldier, not one. She knew all our names, all our hometowns, who had kids, who had wives, who was scared, who was brave. He pointed at Keller with the hand that wasn't bandaged. She took a bullet in Kandahar, pulling me out of a burning Humvee. Took it in the shoulder. Kept dragging me anyway. Didn't stop until I was behind cover. His eyes swept the ER. Found Dr. Voss. Whatever you think you know about triage, about trauma, about combat medicine. She wrote the manual. Literally. It's what they teach at Fort Sam Houston now, the Keller Protocol. Maximum saves under resource-limited conditions. He looked back at Keller. 17 casualties. She saved 13 in 3 hours. In hell, with no backup, no resupply, no support. 96% save rate across 4 deployments. That's what her record says, 96%. Most combat surgeons are happy with 70. Keller's face crumpled. She put her head in her hands, but all she could see was the 4%. All she could hear was Daniels calling her name. All she could feel was the weight of every choice she'd ever made. Dr. Voss knelt beside her, put a hand on her shoulder, said nothing. Sometimes there was nothing to say. 3 hours later, Dr. Voss found Keller in the supply closet. She was back in her janitor uniform. The blue shirt with her name patch removed, the utility pants with bleach stains on the knees. Her mop bucket sat beside her, freshly filled, like nothing had happened, like she hadn't just saved 6 lives and cracked open a chest in the middle of the ER and commanded a team of doctors like they were combat medics in a forward operating base. Keller was reaching for the door handle when Voss spoke. Wait. Keller's hand froze. She didn't turn around. The silence stretched out, long enough to hear the ventilation system humming, long enough to hear someone laughing down the hallway, long enough to feel the weight of everything unsaid pressing down like atmosphere. I owe you an apology. Voss's voice was quiet. Careful. We all do. Keller still didn't turn. I saw a janitor. I should have seen a human being. That was inexcusable. The way I spoke to you, the way I dismissed you, that was wrong. But more than that, what you did tonight saved 6 lives we would have lost, all 6 of them. Even the expectant case is still breathing. Keller's shoulders tensed. I can't stay. This was a mistake. I shouldn't have gotten involved. I should have walked away. Voss stepped closer. Was it a mistake? Because from where I stood, you just reminded yourself of something. What? Keller's voice came out harsh. That I can still make impossible choices? That I can still decide who gets saved and who doesn't? That's not something I wanted to remember. The door opened behind them. The hospital administrator walked in. The chief of surgery followed, both of them looking at Keller with expressions she couldn't read. Commander Keller. The administrator's voice was formal, professional. I've spent the last hour on the phone. Keller closed her eyes. Here it comes. The questions about credentials, about liability, about why she was working as a janitor when she should have disclosed her background, about lawsuits and insurance and all the reasons she couldn't stay. With Walter Reed, with Fort Sam Houston, With your former commanding officer, Colonel Bradford. Keller's eyes snapped open. Your record is extraordinary. The administrator held a tablet, scrolling through information. Truly extraordinary. Keller's jaw clenched. I'm sure you also found the investigation, the congressional inquiry, the headlines. I found a combat surgeon with a 96% save rate under impossible conditions. The administrator looked up. I found 17 commendations, 4 medals for valor, testimony from 143 soldiers whose lives you saved personally. He scrolled further. And I found one impossible choice that you've been punishing yourself for ever since. The chief of surgery stepped forward, offered a folder. Trauma attending position. You'd run our emergency surgical program, build it from the ground up, train the residents, develop protocols. Keller stared at the folder like it might bite. No triage calls you don't want to make. The administrator's voice was gentle now. No impossible choices alone. Full team, peer review, support, counseling, mental health resources, whatever you need. Keller didn't reach for the folder, didn't move. I can't. You don't understand. I can't make those decisions anymore. The supply closet door opened again. The resident who'd mocked her earlier stood there, face red, eyes down. I'm sorry. His voice shook. For what I said. For how I treated you. For telling security to remove you when you were trying to help. He looked up, met her eyes. Would you teach me? What you did tonight. The thoracotomy. The triage. The way you commanded the room. All of it. Other residents appeared behind him, clustering in the doorway. All of us. Please, we want to learn. The older military nurse pushed through. Some of us never stop serving, Commander. We just find new ways, new missions, new teams to lead. Then, the first soldier appeared. The Green Beret. Walking now, slow but steady, a V-pole beside him but moving under his own power. You told me in Kandahar that every life you saved honored the ones you couldn't. His voice was strong, clear. You still believe that? Keller felt tears coming. Hot, unwanted. I don't know. I don't know what I believe anymore. Then let us believe it for you. The soldier's hand went to his chest, to his heart, until you remember. Keller looked at all of them, at Voss, at the administrator, at the chief of surgery, at the residents hungry to learn, at the nurse who recognized a fellow veteran, at the soldier who wouldn't let her forget who she'd been. Her hand reached out, slow, shaking. She picked up the folder, opened it, read the first page. Trauma Surgery Fellowship Director. Teaching position. Department head. Full authority over emergency protocols and resident education. She looked up at the residents, at the nurses, at Voss standing there with something like hope in her eyes. I have conditions. The administrator straightened. Name them. Mental health support for staff. Mandatory. No stigma. If we're going to make life and death decisions, we need to be able to process them, talk about them, get help when we need it. Done. Peer review on all triage decisions. No one decides alone. Every critical choice gets reviewed by the team. Discussed, evaluated, learned from, agreed. Keller took a breath. And a veteran transition program for combat medics becoming civilians, so no one else has to hide who they are for 4 years, so they know they're valued, that their skills matter, that they belong somewhere. The administrator extended his hand. Deal. When can you start? Keller looked down at her janitor uniform, at the mop bucket sitting beside her, at the life she'd built out of shame and silence and self-punishment. I need to finish my shift first. A small smile. The first real smile in 4 years. Old habits. 6 months later. The trauma bay was organized chaos. 3 residents working on a gunshot victim, 2 nurses managing medications, a respiratory therapist adjusting ventilator settings, everyone moving with purpose, with coordination, with the confidence that comes from training and trust. Keller stood at the head of the bed, white coat over scrubs, trauma surgery, fellowship director embroidered on the pocket, her hands steady as she guided a resident through a chest tube placement. Remember, her voice was calm, patient. Every patient is someone's soldier, someone's child, someone's reason to keep breathing. The resident nodded, hands steadying, following her guidance. On the wall behind them, a whiteboard showed statistics. Keller protocol, team-based trauma triage, save rate 94%, up from the hospital's previous 71%. A younger resident raised her hand. Commander, when you're doing combat triage, how do you decide between two patients with similar injuries? Keller moved to the teaching board, started drawing. You don't decide alone, you assess with your team, you use the data, you trust your training, and you remember that every choice is reviewed, discussed, learned from. No one carries that weight solo anymore. The trauma bay doors opened. A new veteran walked in. Former Army medic, first day as an EMT, eyes nervous, shoulders tight. Keller excused herself from the teaching session, walked over, extended her hand. Welcome, I'm Commander Keller. I run the trauma program here. The veteran's eyes widened. You're the Commander Keller? They teach the Keller protocol at Fort Sam now. I learned it in combat medic training. Keller smiled. Then you're already ahead. Let me show you around. Introduce you to the team. We're glad you're here. The veteran's shoulders relaxed. Just like that. Seen. Valued. Home. Dr. Voss approached from the other side of the trauma bay. Now a colleague, now a friend. Commander, incoming mass casualty, 4 critical, factory accident, ETA 3 minutes. Keller was already moving, shedding the white coat, grabbing scrubs. How many? 4 critical, 2 urgent, unknown number of delayed. Keller's hands reached for gloves. Steady, sure, no tremor, no hesitation. Get me a team. Alert the OR. Activate massive transfusion protocol. Let's bring them home. The residents mobilized, the nurses prepared. The entire trauma bay transformed into a coordinated machine. Everyone knowing their role, everyone trusting the system, everyone working together. The sirens got louder. Keller stood at the center, not hiding anymore, not running, not pretending to be someone she wasn't, just doing what she was meant to do. The ambulance doors burst open. Here we go. Her voice was steady. Her hands were ready. Her team was beside her, and somewhere in the corner, gathering dust, sat an old mop bucket. She didn't need it anymore. She'd learned that you don't heal by hiding. You heal by doing what you were meant to do, by leading, by teaching, by saving the ones you can. And maybe, just maybe, that honors the ones you couldn't. The first gurney rolled in. Keller's hands moved, precise, calculated, perfect, just like they always had been, just like they always would be.